All right, which brings us to biosynthesis. So when you talk about biosynthesis of aldosterone, you're really also getting into the biosynthetic pathways and the adrenogenital syndromes. And so we'll tie that in a little bit. But again, when it comes to the adrenogenital syndromes, there's three enzymes you have to remember: 17-hydroxylase, 21-hydroxylase, 11-hydroxylase. I can remember that. Adrenogenital syndromes, where you have failure of cortisol production, right? So all three are deficient, but aldosterone biosynthesis is only dependent on 21-hydroxylase, 11-hydroxylase, and then we have this little step down here, aldosterone synthase, stimulated by angiotensin 2. And when it comes to aldosterone secretion, again, I'm saying it's ACTH independent, so ACTH is absolutely driving the cortisol pathway. But as far as aldosterone goes, it's ACTH independent, but it creates this permissive role. So when ACTH is high with the adrenogenital syndromes, it just creates more substrate that ultimately drives additional aldosterone secretion, as we'll see. All right, so we're talking about biosynthesis. First step, 21-hydroxylase, right? If you don't have 21-hydroxylase, you don't get to this little fella I call mini aldosterone. So you have nothing. This whole pathway is absolutely dead. And you have all those symptoms that we talked about of aldosterone failure: adrenal insufficiency, hypotension, hyponatremia, hyperkalemia, acidosis. Right, classic onset is going to be that young child, 10 days old, who presents with these signs or symptoms. But when 21-hydroxylase is deficient, you have aldosterone failure. But what's going on? The androgen pathway is just fine. That's fully intact. And so you have this increased 17-alpha-hydroxylase activity, increased 17-hydroxyprogesterone, and you get increased androgens, and they'll manifest themselves differently based on whether or not it's a male or female. This is a aldosterone talk, not an adrenogenital syndrome talk. But the key thing is 21-hydroxylase, adrenal failure, and you wind up with the increased androgen. And again, the focus here is on aldosterone biosynthesis. We're just coming down the pathway. With 11-hydroxy deficiency, you do get to this deoxycorticosterone, and it has aldosterone-like activities. So with 11-hydroxylase deficiency, you basically still wind up, right? So it's going to be driven. The pathway is driven. Remember, what's driving it is cortisol, right? There's no cortisol in the adrenogenital syndromes. And so you have this high ACTH creating precursors. And so with 11-hydroxylase deficiency, you actually wind up from this deoxycorticosterone with basically hyperaldosteronism and the signs and symptoms: hypertension, hypokalemia, elevated bicarb. But in this instance, it's the same story. You're not making cortisol, so the 17-hydroxylase pathway is still going, and these patients are going to have high androgens. In a male, it's going to be represented by precocious puberty, a female, ambiguous genitalia or delayed menarche. And then lastly, just to finish the biosynthetic pathways and adrenogenital syndromes, is you can have deficiency of 17-hydroxylase. And if that's the case, it's kind of like 11-hydroxylase deficiency, increased aldosterone big time, and all those signs and symptoms of hyperaldosteronism. Okay, so those are your pathways. And with 17-hydroxylase deficiency, now you have an androgen failure, and that ambiguous genitalia is going to be on a male. Females are going to have signs of virilization or masculinization. So that is the biosynthetic pathways. The other key player here, again, in terms of this ACTH independence, is when you're hypoaldosterone, right, 21-hydroxylase deficiency, right? What's going to go on? The kidney. The kidney looks to stimulate aldosterone biosynthesis. And what's the player there? Renin-angiotensin. It's angiotensin 2 stimulates aldosterone synthase to get you to aldosterone. Okay? So in any question where they ask you about aldosterone failure of any kind, what's the response? How does the body respond to that? Well, it's the juxtaglomerular apparatus. Renin-angiotensin. Those are going to be up in response. Okay? And those are actually, basically, biosynthesis are related to the regulators. Not much to say about regulation. It is regulated by the kidney renin-angiotensin system. And angiotensin gets us to aldosterone via aldosterone synthase. Good. So that's actions, biosynthesis, regulation, the disorders.